Hello friends, welcome to Nursing in Health. Today I will discuss some important MCQ question for staff nurse examination and RRB examination and CHO preparation. So start the video. First question. What is the cause of anemia in chronic renal failure? Decreased erythropoietin, hemolysis, production of immature RBCs, inappropriate renal functioning. Right answer option A. Decreased erythropoietin. Next, in following, which is not a cause of hypokalemia? Vomiting, potassium wasting diuretic, aldosteronism, renal failure. Right answer option D. Renal failure. Nephrotic syndrome is characterized by pyuria, oliguria, hematuria. Hematuria, azotemia, hypertension. Proteinuria, edema, hyperlipidemia. Hematuria, proteinuria, hypertension. Right answer option D. Hematuria, proteinuria, hypertension. Is normal heartbeat is initiated by which of the following? Sinoatrial node, bundle of His, cardiac center of medulla, sympathetic nerve. Right answer option A. Sinoatrial node. Next, when blood pressure fall, which of the following is secreted by kidney to raise it? Renin, aldosterone, epinephrine, erythropoietin. Right answer option A. Renin. Glasgow Coma Scale has all except sensory response, motor response, verbal response, eye opening. Right answer option A. Sensory response. Exophthalmos of the eyes is a characteristic sign of Graves' disease, Gusing disease, myxedema, cretinism. Right answer option A. Graves' disease. Abnormal sensitivity to light is known as aphasia, photophobia, hydrophobia, diplopia. Right answer option B. Photophobia. Aphasia means language disorder. Hydrophobia is fear of water. Diplopia means double vision. The blood contains 95% of water, 60% of water, 80% of water, 50% of water. Right answer option B. 60% of water. When neurologist asks a patient to smile, which cranial nerve is being tested? Facial nerve, accessory nerve, vagus nerve, optic nerve. Right answer option A. Facial nerve. The cell involved in the specific immune response are derived from spleen, bone marrow, immunoglobulin, lymphatic tissue. Right answer option B. Bone marrow. Next, according to WHO, the blindness is defined as visual acuity is less than 6/6, 6/60, 1/60, 18/60. Right answer option B. 6/60. Which of the following test is used for diagnosis of scarlet fever? Widal test, Dick test, Dagri test, MGIT. Right answer option B. Dick test. Deficiency of iron in children causes which of the following disease? Goiter, anemia, ricket, beriberi. Right answer option B. Anemia. Most important objective during the post-burn phase is to relieve pain, replace fluid volume, prevent infection, replace blood loss. Right answer option B. Replace fluid volume. Edema is most effectively controlled in patients with heart failure by restriction of sodium, proper positioning, fluid restriction, medication. Right answer option A. Restriction of sodium. Which drug is preferred for prophylactic therapy of mild to moderate asthma? Formoterol, montelukast, ipratropium bromide, theophylline.
Right answer option B, montelukast.
The disease athlete's foot is caused by fungi, bacteria, protozoa, nematode.
Right answer option A, fungi.
White blood cell acts as a defense against infection, as source of energy for clotting blood, as a medium for oxygen transport from lungs to tissue. Right answer option A, as a defense against infection. Thanks for watching. Please like, share, comment in video and subscribe my channel.